Spector's heritage assessment was completed on Kevin Horst, a 55-year-old male from rural Pennsylvania. His parents and grandparents were all born and raised in Pennsylvania farm areas with a large Pennsylvania Dutch population. This genogram was completed on 3 generations of Kevin's family. Current ages of family members are in black numbers. Age at death for deceased family members is crossed out in red, and causes of death are highlighted in yellow, while known medical histories are in plain black letters. Kevin is the youngest of 5 children, with 1 sister and 3 brothers, all living. He reports his siblings are in fairly good health, aside from hypertension in 2 brothers and depression and anxiety in his sister. Kevin's father, Samuel, died at age 55 from a heart attack. Previous to his death, he had a medical history significant for hypertension and a malignant brain tumor. Samuel had 1 older sister, Mary, who died in her 70s, though Kevin is unsure of the cause of death. Kevin's paternal grandfather, Walter, died at age 71 of a heart attack, and his paternal grandmother, Elizabeth, died age 80 from a stroke. Kevin's mother, Margaret, is 86 years old and is living with chronic conditions including hypertension, hyperlipidemia, depression, cataracts, and coronary artery disease. Margaret is the oldest of 5 children. Her 3 sisters and 1 brother are in their 70s and 80s, and Kevin is unsure of their medical histories aside from Margaret's brother, Carl, having had a heart attack in the past. Kevin's maternal grandfather, Paul, died at age 85 after complications following a stroke, while Kevin's maternal grandmother, Dorothy, passed age 103 from natural causes. Kevin reports having his own medical history significant for hypertension, hyperlipidemia, arthritis, and obesity. Potential health risks for Kevin in relation to his family history include a risk for stroke, heart attack, and coronary artery disease, along with hypertension and hyperlipidemia, with which he has already been diagnosed. Some opportunities, then, for health promotion that can be subjective teaching for Kevin include prevention of stroke, prevention of heart disease, and signs and symptoms of a heart attack. The Centers for Disease Control and Prevention reports that up to 80% of strokes could be prevented through lifestyle changes such as a healthy diet, moving towards a healthy weight, and increasing physical activity. Risk factors for stroke and heart disease are similar, and Kevin already has some of these risk factors, which include a family history, high blood pressure, high cholesterol, obesity, and a history of smoking. So being taught about these risk factors and how to reduce them to help prevent stroke and heart disease would be beneficial to him. In addition, because of his significant family history of heart attacks and his personal risk factors, it would also be valuable for Kevin to be taught the signs and symptoms of a heart attack.